Welcome back to the RX class. I'm your host, Dr. Guang Chen. I have a very special episode today as I sit down with a good friend, Dr. Shannon He. Shannon graduated from the University of Sydney after studying Bachelor of Science and Bachelor of Dentistry. She served as a dental officer in the Australian Defence Force for over 4 years after graduation. She then continued to build her professional skills by working in various clinics around Queensland and New South Wales, Australia. Shannon enjoys all aspects of general dentistry and takes particular interest in restorative dentistry, implant dentistry, oral surgery, periodontal treatment, and management of oral sleep apnea. She enjoys educating patients about good oral hygiene practices and dentistry in general. A quick disclaimer before we start. Please note that throughout the podcast episode, the information presented is general in nature and used at your own risk. Complex concepts may be oversimplified for entertainment purposes. Symptoms and medical conditions, as well as the diagnosis and the treatment of these conditions, may be mentioned. The information presented do not constitute the practice of medicine nor replace medical advice from a licensed medical professional. Do not rely on the information to make decisions about your or someone else's health. Please seek help from a certified health practitioner if you have concerns or symptoms. Products and brands are mentioned in today's podcast. These are mentioned as examples rather than recommendations. Product availability may vary depending on your region. We do not have affiliations with these products or companies. Please consult your dentist for a personalized recommendation. Please enjoy my conversation with Dr. Shannon He, where we go through all things dental and preventative dentistry. Please enjoy. Today I've got a very special guest, Dr. Shannon He. She's a general dentist who currently works for Defence Health as well as in private practice in Sydney, Australia. It's been such a long time since I've seen Shannon, and it's good to catch up in person. Would you like to tell us a bit about yourself, Shannon?
Oh, hi. Yeah, thanks for having me on the podcast, Grant. It has been a while, so it's great to see you. After graduation, I spent a few years in Brisbane, working for defence. As an army dentist. Had some great experience, and then I moved into private practice. Eventually, moving back to Sydney, and then now in, I guess, both defence dentistry and private practice, and it provides a really nice balance for me. So yeah, really enjoying it, and yeah, glad to be on the show with you today.
Well, Shannon, can you tell us a bit about your work with Defence Health? Do you have to learn anything? Do you have to be able to? Are you trained in using weapons or self-defense?
Uh, yes. So I was sponsored by the ADF to complete my dentistry studies, and then while I was studying, there wasn't that much training to speak of, but after graduation, you do have to go through some army training. So there was a bit of weapons training, which was fun, interesting. You have to do some exercises out in the bush in like northern Queensland. So that's also a very unique sort of experience. So I guess the main thing with working as a dentist for the Defence Forces, you're not just doing plain dentistry. I mean, that is a big part of your job, but you also have to be, managing your duties as a military officer at the same time. But right now I'm working as a contractor on the defence bases in Sydney. So that's slightly different. So I'm now essentially a civilian. So my main focus in my role is to provide dental care for defence members in my care. It helps to have a bit of background military knowledge, knowing how things work and things like that. So, for example, in private dentistry, you just work with patients around their work commitments and family commitments, but it's generally pretty easy to reschedule appointments. But in the defense environment, people often get sent on exercises and so on. So you have to manage that, and they have to be dentally fit to a certain standard before they can be deployed.
I guess the patients you serve in the Defence Force, are they mainly adults, or are you also looking after their children? Or how does that differentiate from, say, general dentistry, where you might be looking after the family from the young, from a newborn all the way to grandmother or grandpa?
Yeah, so we only see defence members. We don't see their families. So all our patients are, essentially adults, from 17 to I think the oldest I've seen was 71. So 17 to 71, that sort of range. Of course, most of them are, in their prime years, so in their 20s and 30s and 40s.
Okay. And I also know that you're doing some private practice. And do you have a specialization or some special interest in your private practice, or again, mainly general dentistry?
So yeah, so in my private practice, I I mainly practice what we call bread and butter dentistry. So the checkups, the cleans, the fillings, the crowns, the root canals, etc. Yeah, so my I don't really specialize in anything per se, but I do have a strong interest in periodontal diseases. So in in general term, that's gum disease. So it's something that's often overlooked because these days a lot of patients are very much into the cosmetic side of things, whitening, veneers, full mouth reconstructions, etc. But a lot of the time it's very well, people don't understand that good gum health is the basis of all of that. So without good gum health, you achieve a stable long-term result with any of these more cosmetic sort of treatment. So my interest is in identifying, diagnosing, and managing periodontal diseases. So it could be something very simple, like gingivitis, inflammation of the gum leading to bleeding, all the way up to more advanced periodontal disease where the supporting bone for the teeth have receded, leading to mobile teeth and sometimes loss of teeth. Yeah, so that's something that I like doing. Of course, part of that would involve oral hygiene instructions. We need to provide that to patients. Often people, it's not that they don't want to look after themselves, it's more that they don't know how to look after themselves, how to brush correctly, why do we use floss or interdental aids, and how to use these aids. So I find satisfying providing these instructions to patients, and often when you have receptive patients, you end up with pretty good results.
I guess for the general audience who might not really understand, I guess, the basic structure of, say, a tooth or the gum, can you give us a quick rundown of what is the gum and which part is considered, I guess, I mean,
The anatomical.
in my very basic in my very basic understanding, I mean, I know that the pink meaty part underneath it is what I normally consider to be the gum. Which part and how far does it go down, and in a simple way, so that I guess the people listening at home can have an idea of what we're talking about.
Yeah, yeah. No, no, that makes sense. When I talk to patients, if I tell them, hey, you've got gum disease, sometimes they look at you blankly, what do you mean by gum disease? What's So yeah, let's go through the basic structure of, I guess, teeth and gum. So yes, you're quite right. The pinky part in your mouth, that's the gum, the supporting, I guess, structure for the teeth. So with in, in regards to the actual structure of teeth. So in simple terms, you've got three layers. So the outer layer, we call that enamel. So that's the hard layer that's help your teeth to become more resistant to tooth decay bacteria. And then you have a second layer underneath that called the dentine layer, which is softer. And then underneath the dentine, you've got a pulp chamber, so a space where all the nerves are housed. So essentially, these three layers work together to form a tooth. Now, the enamel layer is hard, but often it's translucent. The translucency is a little bit different for each person. The dentine layer, which is the second layer, tends to be a little bit more yellow. So people with very translucent enamel layer can end up having teeth which look a little bit more yellow because the dentine layer shows through a little bit more. Whereas if you've got a thicker enamel layer, then your teeth might actually look a little bit more white because it's a little bit more opaque. In terms of the gum surrounding the tooth, so the tooth is not just floating in the mouth. Every tooth is held in your mouth by bony structure. And between the bony structure and the tooth, you've got soft tissue. So we call that gingiva. So essentially the gum. And so when you don't clean your teeth properly, then between the gum and the teeth, so you've got gaps. And these gaps, if you have food trapped in that, that's when you end up with redness, inflammation, bleeding, and so on. So when we are brushing teeth, we're not just brushing the outside layer of the teeth. We're also trying to clean the gaps between the gum and the teeth.
And so, how far does it go down? Is it just the bit that's just covering the bottom of the tooth, or does it kind of? I mean, obviously, the gums almost goes continuously around to to the cheeks and to the base of the tongue. So, where does it kind of start and stop in terms of the pink meaty bit?
All right. Okay. So you've got technical terms. You've got attached gingiva and free gingiva. So attached gingiva is usually the bit that we're talking about when we colloquially referring to gum. So that's the firm part that you can feel around the roots of your teeth. So if you run your finger around it, around the roots of your teeth, then you can,
Yes,
yeah,
that's covering the jawbone, is it? And
covering
the the mandible and the maxilla.
that's right, covering the alveolar bone around the teeth.
Okay. And you mentioned, I guess, in terms of the best way to brush your teeth. What's your kind of best strategy of brushing? How often should you brush? What kind of brushes should you use? Are there any differences? What about toothpaste? Do you have a kind of a general basic explanation so that patients can kind of navigate through the massive aisles of, of toothbrushes and toothpaste that are available in the supermarket?
Yes, yes. So look, okay, we can talk about the toothbrushes first. So toothbrushes, there's often a common misconception that the harder the toothbrush you use, the cleaner, you know, you can, the better that you can clean your teeth. But actually, we encourage patients to use softer toothbrush, extra soft if you can, because it's not about how much force you apply when you're brushing. It's more about the technique. So the recommended brushing time is 2 minutes. And during those 2 minutes, ideally, you should be covering all surfaces of your teeth. So I find a lot of people don't really have a system when they're brushing. It's more just randomly, wherever your toothbrush end up at. I recommend patients to have a system. So for example, you can start from the lip side of your teeth and gum and do gentle circular motions at about 45-degree angle where the bristles sort of aim down for the bottom teeth. And then you do gentle circular motion all the way across to the other side. And then you switch to the tongue side. And then again, gentle circular motions. And then finally, you brush the chewing side of these bottom teeth. And then you repeat the same for your top teeth. Just remembering to aim the bristles towards the gum at about 45-degree angle. So yeah, so soft, gentle, circular motions with a ideally soft toothbrush. Now, some people ask, is it better to use manual toothbrush or electric toothbrush? In a nutshell, it actually doesn't matter. It's more about how you brush. But I do find personally that electric toothbrush, after you brush with electric toothbrush, it feels a lot cleaner. And a lot of the current generations of electric toothbrush do have smaller heads, so it may be easier to get to certain areas. Now, if you choose to use an electric toothbrush, you don't want to be doing the circular motions because they already have the um, oscillating or rotation movement. So you're basically just placing the head over the area that you are focusing on and just let it do its work for a few seconds and then move it to the next next tooth or next sets of tooth. So yeah, so that's the toothbrush side of things. Now, in terms of toothpaste, just make sure you use a fluoride containing toothpaste. We can probably have a whole other discussion about why fluoride is important, but I know that herbal toothpaste are or natural toothpaste are very popular these days. Unfortunately, they don't offer enough protection against tooth decay. So whatever toothpaste you choose, pick the one that contains fluoride. In terms of other subcategories, so then sometimes you've got whitening toothpaste, you've got gum protection toothpaste, you've got sensitivity toothpaste. I mean, look, they all have their purposes, but if you're not looking for a particular need, something common like Colgate Total will probably do the job just fine. But if you, for example, have very sensitive teeth, then you might want to look at using something like Sensodyne, which tends to work quite well if you use it for the long term. It really does reduce the extent of sensitivity that you feel. In terms of whitening toothpaste, I don't. Some people think they work over a long time, but I feel like if whitening is your goal, there are better ways to go about it, such as Zoom whitening or just using whitening bleach.
I mean, I guess from my personal experience about brushing, like I normally brush until when I run my tongue over my teeth and I feel like it's not furry. I'm not sure if that's a good gauge of whether it's clean or not. Like, how do you gauge if you've done a good job of brushing your teeth? Other than that, you've spent 2 minutes and you've gone all the way around. Like, do you have way of telling the patient, well, is it that you want to have some sort of feeling, or you can't kind of you don't taste any of the residual food, or should you be brushing until you get bleeding? And what does that, is that a good or bad thing to have?
Yeah, so that's a great question. How do you know that after brushing the way you did? How do you know that you've actually done the job? I mean, I do have people who come in and tell me, Doctor, I brush my teeth twice a day religiously. How come I still have bleeding gums and this and that? Well, often I find that if you actually brush the right way, your teeth will remain clean. And so by that I mean if you run your fingernail across the surface of your teeth, you won't really get anything. Now, if you don't brush your teeth for a day and then you run your fingernail across the surface of your teeth, you'll probably see this layer of white stuff. So that's like the furry stuff Grant was talking about. So that's essentially what we call plaque. So it's basically a congregation of, food residues, bacteria secretions. And yeah, so that soft part plaque is essentially what we are trying to clean off when we are brushing teeth. So that plaque can be on the surfaces of teeth. It can be in the gap between the gum and the teeth. And yeah, I guess if you really want to check, you know, use your fingernails to scratch your teeth. Do you have any of that white stuff, on your teeth or not? Yeah, if the other way to check, I suppose, is it's more indirect. Now, if you haven't been cleaning off the plaque effectively, your gum will bleed. So maybe it might just be a little bit of bleeding, or it might be a lot of bleeding. Build-up of plaque over time can lead to inflammation of the gum because it's a foreign object to your body and your gum won't like it. So if you haven't been brushing effectively, your gum will bleed. Your gum is, I guess people say that, oh, if I brush my teeth too hard, my gums start bleeding. It's actually the other way around. It's because you haven't been brushing effectively. That's why you've got the buildup of the plaque, which then leads to the bleeding. Oh, and we haven't talked about it yet, but brushing itself is probably not enough. You also need to be flossing and cleaning the in-between areas of the teeth as well. In terms of, what was the other thing you talked about?
No, I think
Bleeding?
you covered. It was
Yeah, I
about
think,
bleeding, and I guess the furry bits. That was good. That was good. I think that's very helpful for people at home.
yeah, because
But yes, flossing. I guess we'll come to.
well, flossing will cover another time. But the furry stuff. I actually had a patient the other day was asking me. It was a little kid, and then he was like, sometimes, doc, sometimes I get these white stuff. I can scrape it off my teeth. What are they? So yeah, so I had to tell him the exact same things, and also that if you don't clean off that white furry stuff, it actually hardens and it becomes what we call calculus, which is like hardened plaque. And there's no way you can brush that off. That can only be removed at a dental clinic. So we use our specialized tools and clean that off as part of scale and clean.
Okay. Well, look, I mean, we've still got a bit of time. Look, maybe we might cover the floss topic, and I guess if you could explain the different types of flosses, does it really matter whether it's you use your own fingers and you just use a long string of floss versus the ones that are pre-packaged in a little plastic toothpick, and how should we use it and how often?
Yeah, so with floss, yes, mainly you've got two types. The first one is a traditional floss. So they come in like 25 meters or 50 meters, I think. And then you've got the flossets, which are like little forks with the floss across the two ends of the fork. Look, they both actually, there is a third type that's becoming quite popular, water floss. But we'll talk about the first two first. So the traditional floss, you have to tie it around, your fingers, and there's a specific way of, I guess, having your fingers in your mouth so that the floss can go between the teeth. And the basic movement is going up and down between two teeth. So you are essentially doing like a wiping motion. And then you go slightly below the gum, not too hard, because if you go too hard, it can traumatize the gum. So just slightly below the gum, wipe up and down, and then you move it so that you've got a cleaner part of the floss for the next gap that you'll work on. The floss sets work the same, but they are a little bit more flimsy because you'll find that once you put it through gap and then you pour it out, that floss part actually becomes quite flimsy. And then if you try to use that for your entire mouth, yeah, it's probably not very effective. And also, you are not really using a clean part, like a clean part for each gap. I mean, I guess you can choose to use a few flossets for working around your whole mouth. It's actually quite expensive. These stuff are expensive. The cheaper option and the more effective option is just our traditional floss. Now, the third type, which is water floss, essentially it works by sort of spraying a jet of water between the gaps of the teeth, in the process removing whatever's caught there. What I find is often it's okay for maybe the smaller particles, smaller plaque, but if you've got something big stuck between your teeth, it might not be that effective at removing that because the force is not strong enough. So if you're someone who don't think you'll ever floss, maybe water floss is a good option, better than doing nothing. But if you really want to have a go at really improving your oral health, I would encourage you to try traditional floss. Maybe get your dentist next time to show you how to use it. I'm sure there are lots of YouTube videos out there showing you how to use a traditional floss. And flossing needs to be
And
done once a day. Once a day. Once a
once a
day.
day. Okay.
Yes.
All right. Does it matter if it's morning or night?
I guess it doesn't really matter, but I mean, once a day I find it is sufficient, really.
And what about brushing? Once, twice, three times a day?
Brushing twice a day, normally morning and then nighttime before you go to bed. But some people do choose to, brush after lunch as well. And I think that's fine as well.
What's your view on mouthwashes? Can you use mouthwash instead of brushing or flossing? Or is it just an extra tool in maintaining better oral health?
Mouthwashes, we've got a lot of different mouthwashes on the market and they all have different ingredients, therefore different functions. But the main thing is if you're going to use a mouthwash, make sure you pick one that doesn't contain alcohol, because alcohol containing mouthwashes have been sort of shown to have some sort of correlation with oral cancer. So we don't encourage that. Now, in terms whether you need to use it routinely or not, I find if you brush twice daily, floss every day, you're probably okay without using a mouthwash. But if you're a bit more slack per se, or for example, if you go through a period where your gum is quite inflamed, then you might benefit from using say something like Savacol, which is like a chlorhexidine containing mouthwash. So that's Colgate. I think Oral-B also has something similar. Yeah, I guess in a nutshell, you don't have to use a mouthwash, but there are times where you might find that it's beneficial for you to use one. Might be a good idea to check with your dentist as well when you go for your checkup and clean next time, you know.
Oh, thank you so much, Shannon. Where do you see kind of dentistry heading in the next 5, 10 years? Is there any exciting technology that you're interested that will be coming online that will help, I guess, yourselves as dentists and also as patients to improve better oral health?
Well, with the advent of artificial intelligence, I certainly hope that our jobs won't be overtaken. I don't know, maybe one day they'll have robots who can actually do what we do. Look, on a more serious note, in the next 5 to 10 years, I don't think there will be too much change to the core of the basics of dentistry, but there may be a lot more sort of digitalization or digital components. I mean, we're already seeing a trend of that. So, for example, instead of taking traditional alginate impressions of teeth these days are done with digital scans. Models are not being poured up; they actually 3D printed, um, and a lot of the, like, for example, surgeries like implant surgeries, you have guided implant surgeries, you have atraumatic implant surgeries, that kind of stuff. So I see that, development in this area will continue. We'll probably be incorporating a lot more digital technology in our diagnosis and treatment. Other things I can think of, laser treatment. So traditionally, for example, root canal treatment, so that's basically removing the nerves inside the teeth, clean the teeth, and then pack filling materials down it. Traditionally, the cleaning part is done with chemical agents, but lately there's been a trend in using laser to do the actual cleaning part. So that's also interesting. And I think, can't remember where I read, but somewhere they are trying to grow teeth. I mean, I don't know if that's going to take place. That would be awesome if it does. And there are people trying to grow teeth. So we'll see what happens, in the future. Who
Oh,
knows?
it's very exciting. Very exciting.
Yeah.
Well, thank you again, Shannon. I hope we can catch up again and obviously share more knowledge to help people at home to improve their general dental and oral health.
Yeah, yeah. Would love to come back again sometimes. Yeah, thanks again for having me here. And I guess everyone, see you next time.